Henderson Mill Elementary. It's Dr. Abby Huggins. Although my last name that you guys might know is Mowinski. I'm Jack's mom in the 4th grade, and I am a small animal veterinarian. So in honor of Career Day, I thought I would make a little video for you guys to show you about being a vet and our hospital, and most importantly, how being a veterinarian has to do with everything about STEAM. So my job every single day is science, technology, engineering, art, and math, all packaged into one great job. So behind me, you see stretching. This is Princess. She's our hospital cat. She lives here with us. And that's one of the perks of being a vet is you get to have pets at the hospital, right? So she is our stay in all the time kitty cat that keeps us company and keeps our patients company. So I thought one thing I would show right now is what's called a dental cleaning. So this is my wonderful combo of nurses, Victoria and Antoinette, doing polishing on this puppy dog's mouth. We just finished cleaning her teeth and I had to pull one kind of wiggly, wobbly, diseased one. But this is a good example of using engineering and technology. So the dental machine, which is this guy that's making all this noise right here, has all sorts of high speed and high pressure instruments that help spin the brush. We do a cleaning. It looks exactly like what your dentists use when you guys go to the dentist. And because dogs and cats don't sit still for us to clean their teeth, these guys are under anesthesia. So here's another great example of science and technology. This unit that I'm doing not so great a job of videotaping, there we go, is called an anesthetic unit. So it delivers a gas that the puppy dog is breathing in and out that keeps her asleep. So she's not feeling anything. She's not scared. There's no pain. And then when she's done, we will wake her back up again because she'll just breathe regular oxygen. This little guy that's moving up and down is actually helping give her lungs a break and helping her lungs breathe, so it's easier for her when she's under anesthesia. Another great example of technology is this unit right here, and this is measuring the dog's heart rate, something called its tidal volume, which means how deep the breaths are that she's taking, how fast her heart rate or breathing rate is going, her blood pressure, etc. So it gives us all sorts of fabulous information. And before our kiddos go under anesthesia, we use this machine over here, which is our blood analyzer machine. So this machine, we draw blood from the animals and we spin it down in something called a centrifuge, and then we put it into this machine and it tells us all about the different parameters of the lab work, how the blood is working, how the organs are working, etc., so that we can make the right choices on how to treat these patients. Another kind of piece of science and technology you guys are probably familiar with is the microscope. We use this guy every single day too to look at things like poop of all things, but we also look at blood and skin and different cells so that we can identify different things happening there. So the next thing I'm going to do is I'm going to scoot us over to X-ray. Dun, da, 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 as we walk through the hospital. Oh, more technology. Look at that. There's a computer for everything, absolutely everything. It stores all of our information, our medical notes, etc. Let's see. Actually, I can pass by. You can say hello to some other patients. This is a kitty cat named Ocho. He is also having a dental cleaning today. He's got a yucky tooth in there. There's another kitty in here called Gray Malkin. And off we go. Little bypass through surgery. Many more machines. Many more things that help us do our job with all of the science that we do here in veterinary medicine. Here's another great example of technology, guys. So this is our digital x-ray unit. So we take regular x-rays. If any of you guys have ever been to the doctor before and needed to have x-rays taken because you hurt your arm or your leg, you know how you have to lay perfectly still. So do these guys. This is a picture of a dog's pelvis. So that's the portion of the body where the back legs attach. And what's really neat about digital x-ray is that we can very quickly kind of shift between different films that we've taken. And it also gives us the chance to get a little bit closer. We can manipulate the images just like that with digital imagery technology. We can make things look closer so that we can see things under better magnification. So all of these are really fabulous ways that we use science and technology and engineering every single day. I'm not going to forget about A for art. I actually use art quite a bit when I'm showing things to different pet owners. I will draw things frequently so that I can better explain things. I will also plan many of my surgeries, kind of thinking from an artistic standpoint, not to make it a beautiful piece of art when I'm closing things up, but I have to think about how, when I make an incision, which means a cut through the skin, how I'm going to close it back together in the best way for that animal. So for example, like if I was going to be showing an owner something, maybe if I was talking about a dog had a wound on its eye, I might draw the eye for the owner, and I might also do that in my chart notes so I would remember where things are. And so here would be, the pupil and the globe of the eye, and I might say, oh gosh, there was a scratch right about there. And in animal medicine, and people too, we actually talk about locations of things kind of like a clock. So 12 o'clock position, 3 o'clock position, 6 o'clock position, and 9 o'clock position. So I would say that this dog had a wound on its eye in the 10 o'clock position, and this would be that animal's right eye. So I would make a little sign like that. So art definitely plays a role. And last but not least, certainly math. I do math every single day, but you know what? I use a calculator because I have to do a lot of conversions. So I'm switching things from pounds to kilograms, and then I'm using that information to figure out a drug dosage in something called milligrams per kilogram. And then if it's in a liquid form, I have to convert that into milliliters and whatnot. So lots and lots of math every single day. So I hope that gives you guys a little peek at what happens inside a veterinary hospital, and very much how it relates to science, technology, engineering, art, and math, just like you guys are learning and incorporating in all your lessons every single day. I hope you guys have an awesome rest of your day, and take care of your pets if you have them, and always, always be nice to animals. Bye, guys.